Arthritis Unpacked is a patient education resource developed and owned by Janssen Australia. The content is created by Dr Paul Bird with the support of Janssen. The information provided is for educational purposes and does not replace the advice from your healthcare professional. Always refer to your healthcare professional about current treatments, possible side effects, and other considerations. Paul Bird is an experienced rheumatologist and researcher dedicated to the expert management of patients with all forms of arthritis and rheumatic disease. As well as caring for patients in his clinical practice, he continues to undertake arthritis research with fellow Australian rheumatologists and international colleagues, ensuring he is up to date with the most recent medical advances.
Welcome to the 5th episode of Arthritis Unpacked, a podcast series designed to help you understand your arthritis better and help you get the best out of your treatment. Join me, Dr Paul Bird, an arthritis specialist, which is also known as a rheumatologist, as together we unpack your arthritis baggage, helping you navigate the maze of arthritis terms and treatments. Arthritis without the jargon, arthritis made simple, Arthritis Unpacked. Today we're going to talk about the role of diet, exercise and reducing stress as really important parts of your psoriatic arthritis management. These are vital aspects of your treatment, really important parts of the management that aren't prescribed medicines. They include things like controlling your weight, exercising regularly, ensuring that you don't smoke, and of course making sure that you eat a good diet. Let's look at each of these in turn, remembering that these things are an essential part of the process of recovery and ultimate wellness. The medicine alone can't do its job if we're not attending to these other important things. Diet has its own episode in Arthritis Unpacked, but I'll make some general comments here to help you. So let's look at diet for psoriatic arthritis. After the medical treatments, this is the question I get asked most about. Is there a diet that cures arthritis? Should I avoid certain foods? Is there anything I should eat to help myself? Let me make something clear. I believe diet modification is a really important part of treating arthritis, but there is no diet that can cure arthritis. I know you can find things online or in books that give you the advice that a diet can cure arthritis, but I must be honest at this point in time. There is no special diet that gets rid of psoriatic arthritis or any other sort of arthritis for that matter without these other measures. So, it's a really important part of the treatment plan, but we don't want to see it's the only thing that you do to help manage your psoriatic arthritis or other type of arthritis. It's important, but it's not the cure. Here's some easy things to remember in short form that will help guide you. The person most responsible for what you eat is you. The best thing you can do is make the decision to look after your body and nurture it to better health. Avoid all the latest fad diets as they generally don't consider the specific needs of those with chronic inflammatory health issues. Choosing a balanced diet simply means including all the food groups and watching your portion size. Now, while there's no specific diet for psoriatic arthritis, researchers have identified certain foods and supplements that may be helpful. These foods comprise what is known as the anti-inflammatory diet, sometimes also referred to as the Mediterranean diet. So, what's in the Mediterranean diet? Fruits and vegetables. Fruits and vegetables contain antioxidants that help reduce inflammation, specifically green leafy vegetables rich in vitamin K like spinach, kale, and broccoli. Whole grains. There is some good evidence that whole grains such as brown rice and quinoa may help. Oily fish and fish oil, generally from cold water fish such as salmon, herring, cod, trout and sardines. If you're looking for an easy place to start turning your diet around, the Mediterranean diet is a great place to start, and it's delicious and healthy. You're probably thinking, I've heard a lot about fish oil. Why the fish? Fish oil has been studied extensively in psoriatic arthritis and other inflammatory conditions. Studies have shown that fish oil can relieve joint tenderness and morning stiffness, reduce the duration of morning stiffness, and reduce disease activity in people with psoriatic arthritis. It can be taken in a capsule form such as fish oil or krill oil. Here are a few rules that will help guide you. These are based on some latest research presented by clinicians and scientists at one of the International Meetings for Rheumatologists, EULAR, in June 2021. Reduce salt. Don't add salt to food. Avoid high sodium foods, generally packaged, and use herbs as a substitute. Reduce sugar. Watch out for sugar-laden drinks and sugar-laden foods advertised as low fat. Add fish oil, sardines, mackerel, salmon, or in capsule form. Use the Mediterranean diet, fruits, grains, fish oil. Increase your fibre with grains and vegetables. Reduce caffeine. Use small amounts of coffee and substitute green tea. Maintain a healthy weight. Every kilo of weight gain increases your inflammation. And alcohol, well, moderation is the key. If you're looking for more information, visit Arthritis Australia or Creaky Joints for more information, or listen to my podcast, Diet and Arthritis in Depth. That's a short tour of diet, and there's a lot more in it, but I'll leave that for another time and another episode. The next part that's really important for you is exercise. While any sort of movement may be the last thing you want to do when you wake up each day feeling stiff and in pain, regular physical activity can go a long way to help you feel better. Many people may also be cautious for fear of doing more damage to their joints. In fact, research shows that appropriate and individually tailored exercise is one of the best ways to treat arthritis. And it does this by strengthening your muscles and tendons, giving more support to the joints, increasing your energy levels, improving your heart health and circulation, and increasing your lung capacity, reducing your weight, generally improving your mood and emotional well-being, and improving your quality of sleep. Some forms of weight-bearing exercise also reduce your risk of developing osteoporosis. The term exercise is broad, and it may invoke images of long hours at the gym or running for miles. And if you're barely capable of walking around the house, then that form of exercise is clearly not for you. Here are some you might like to try: yoga, tai chi, walking, cycling, warm water exercise or hydrotherapy, and muscle strengthening exercises. Move when you can. It's a vital part of the recovery process. The next bit for us to unpack are things like the over-the-counter nutraceuticals. By those I mean things like curcumin, rosehip vital, and glucosamine. These are not essential for patients with psoriatic arthritis. You should view them as mild relievers. They provide some mild relief from inflammation, but on their own they're never enough to help alleviate the problem. It's also important to discuss them with your doctor. We generally don't have any objections to you taking these medications in conjunction with your conventional therapy, but it is necessary for us to know about them. Nutraceuticals like curcumin and glucosamine, think of them as mild relievers. They can help, but they're not essential. The last bit to unpack is reducing your stress. Stress and pain go hand in hand. People with arthritis often have a background level of pain that is constantly just there. We get so used to it that we hardly notice as we go about our day. If something happens that causes us stress, our bodies immediately tense up. A certain amount of stress in our lives is normal and even considered healthy, as stress can also be positive. Where it becomes a problem is when stress factors remain unresolved and the tension in our bodies continues to build up. Having good family or friend supports, joining a support group, reducing your work stress, keeping a positive mental outlook are ways that can help manage your stress and improve your recovery to wellness. As I always say to patients, well, stress is life, but we have to recognise when stress is having an adverse effect on us and do something about it. Otherwise, we get caught in the same cycle over and over. Stress, know where the stress is in your life, how it affects you, and find ways to minimise it if you can. That's a lot of unpacking for now, and I think it's time to put it all back in the suitcase by returning to the patient that we discussed at the start of our series. Shive was understandably frustrated by his symptoms and his journey. The first important part of his journey was providing him with a diagnosis and helping him to understand what was happening to him. In Shive's case, relievers in the form of diclofenac or Voltaren were used, but he also had drainage, otherwise known as aspiration, of his knee, along with cortisone injections to help relieve the inflammation, while the right preventer was found for him. The journey to find the right preventer for him was a long one, however, and that's in part because although we have many medications that we can use to treat psoriatic arthritis, just like in rheumatoid arthritis at the time of recording, we are yet to find really good ways to predict which drug works best for each individual. In Shive's case, he moved through synthetic DMARDs, methotrexate and leflunomide, but unfortunately these did not control his symptoms well enough. Eventually, he stabilised on ixekizumab or Taltz, one of the biologic agents designed to block interleukin-17. Once we eventually got the right preventer on board, however, he reached a state we call remission. That's when someone gets to the point when they barely have any symptoms anymore and they're returning to a normal life. Remission means the disease is under control. It means you keep continuing the preventer to stop it coming back, but we try and get the dose of medications down to a minimum to do the job. In Shive's case, this meant that the knee swelling and the pain disappeared. His psoriasis cleared completely. The fatigue resolved, and any residual enthesitis that he had, pain and swelling at the tendon insertions, was relieved. Shive's treatment journey has been over 5 years, and during that time he experienced the frustration of non-response to initial medication, flares of his symptoms, and the fatigue that comes with having active joint symptoms. But he's continued to surge forward and took on board the advice he was given on diet and exercise, as well as to keep taking the medication. Now he's back to working full-time, playing cricket every weekend, and his wife is expecting their first baby. Each time I see a patient with psoriatic arthritis, I'm reminded of how different the journey is for everyone. Some respond quickly to the first preventer. Others take 3, 4, or even 5 months before we find the right one. Every person is different. And as I close the suitcase today, I want to impart to you that everyone's journey is different, but with the supports around you and a good rheumatologist, you can find your way through the maze and out to the other side. I'm Professor Paul Bird, and this is a podcast all about arthritis without the jargon. Arthritis made simple. Arthritis Unpacked.